All right, everybody, I think we're going to go ahead and get started. Thank you for joining this webinar, Climate Policy is Health Policy, Making Your Case with a Powerful Online Modeling Tool. I am Sarah Spengeman, Deputy Director of Communications for Energy Innovation. And Energy Innovation is a nonpartisan climate and clean energy policy firm. Our mission is to accelerate clean energy by providing customized research and analysis for decision makers to support and implement the policies that secure the largest greenhouse gas emissions reductions. Today, we are delighted to collaborate with the American Public Health Association and the Medical Society Consortium on Climate and Health to demonstrate our energy policy simulator and to provide this training to climate and health advocates to help them make the case that climate policy is indeed public health policy. I'm also very happy that we have two climate and health experts with us today. We have Dr. Adrienne Hollis, who is Senior Climate Justice and Health Scientist at the Union of Concerned Scientists, who will be providing our opening remarks. And then Dr. Neelu Tummala, who is an ENT and Clinical Assistant Professor of Surgery at George Washington University School of Medicine and Health Sciences, who will be sharing her advocacy experience and insights with us at the end of the training. And we also have last but not least, Jeffrey Rissman, our own Jeffrey Rissman, who is the head of modeling at Energy Innovation. He was also the model's chief architect, and he will be providing the training for us. Before we get started, here are a few logistics. Everyone is on mute, but we do encourage you to ask questions using the question box. We're using a Zoom feature that allows you to enter your own questions, as well as vote up other questions that you would also like to have answered. And we'll answer the top questions after Jeff finishes the training. If we don't get to your question today, please feel free to email me any questions that you have at sarah@energyinnovation.org. We'll also be using the polling feature to ask a couple of questions during the training. The poll will open up and you'll have about 30 seconds to select an answer. This is just a fun way to interact with the training, and don't worry if you're having any trouble with it. This webinar is being recorded and all registrants will receive a recording. We will also be publishing a blog in collaboration with APHA that will be featured on both websites, and which will also include the webinar recording, so you can share that with colleagues later on. Finally, I am excited to say that in addition to our new EPS 3.0 model for the US, our California model will also be updated in the coming months and include the new public health features, as well as new models for Virginia, Texas, Minnesota, Nevada, and New Mexico. And we also have about a dozen other state models in the works. So we want to make sure that you stay updated on all of our new model releases. So please go to our website, and my colleague is going to pop that website into the chat box so you can all see it. energyinnovation.org/newsletters. And if you sign up, you'll be able to be updated on all the new model releases. And always feel free to email us and let us know also if you're working in a specific state. Okay, so now it is my great pleasure to pass it over to Dr. Hollis. I'm going to open up her slides for us.
You don't have to do it yet.
Okay.
Okay, so hello everyone. Thank you so much, Sarah and Energy Innovation. I'm so excited to be here and open up this session. So I want to just give you a few reasons why this information that you'll be learning about today is so important, or at least important in the work that I do. I work with environmental justice communities. And I hope you leave with clear answers to at least three very important questions. What is the issue? What is it? How does it affect me, or why should I care? And then what can be done about it? And I hope to cover the first two and then turn it over to Energy Innovation to provide some possible answers or suggested answers to the third. But before we do that, first, a couple of things that we just want to make sure that we're on the same page. Climate change is real, and humans are a big reason for it. It adds enormous amounts of greenhouse gases to those that are already naturally occurring in the atmosphere, and it increases the greenhouse effect and global warming. And we saw it this summer. And three, we need to focus on mitigation, reducing emissions, reducing greenhouse gas release into the atmosphere, and adaptation, learning to live with and to be resilient to the climate changes that have already been set in motion. And to do that, we need to be as accurate as possible about the information we're asking for, we're utilizing when we create policies to protect the public. So the first thing I want to talk about is how climate change impacts health. We get the first slide, because it's impossible to talk about climate change without talking about public health. And you cannot talk about either of these issues, particularly to energy and policy, without talking about environmental justice communities. And I'll discuss that in a moment. So in general, the infographic that you see here is from the CDC, and it highlights the impact of climate change on public health. The American Public Health Association, CDC, and the World Health Organization all agree that climate change is among the most significant contemporary threats to public health. Some health impacts from climate change include injuries and death from floods, illnesses and deaths from heat waves and wildfires, infectious diseases, which are common in certain areas, and indirect health impacts include food and water related infections and water and food shortages, respiratory diseases because of, for example, changes in pollen amounts, air pollution concentrations that increase, and environmental damage that can be due to climate change. So the communities I work with, climate change is what's called a threat multiplier, because these communities are already exposed to contamination from polluting facilities, and they are, for the most part, a lot of them are unable to pay their utility bills. Most of their monthly check goes towards their energy bills. They also may lack access to clean drinking water or cooling centers when the temperatures are extremely high. There may be transportation challenges and so on. So climate change definitely exacerbates existing conditions and lead to worse scenarios. So second slide. Thank you. So I want to touch on the impacts of air pollution on health. And this answers the question, how does it affect me? The first one was, we're talking about climate change and health. Now, how does that affect me? Why should I care? Well, the fact is that Americans are dying from air pollution. That's a fact. Fossil fuel combustion is the largest driver of climate change, and it creates air pollution with no negative impacts. Particulate matter 2.5, or PM 2.5, has accounted for more than 64,000 premature deaths, and that was in 2015 alone. Burning oil, gas, and coal produces air pollution and also drives the climate crisis. Climate change impacts the air we breathe by increasing the risk that air pollution, including ozone and particulate pollution, will worsen. We see this every day. As temperature increases, warmer air helps form ozone, sometimes called smog, and we've seen that in certain areas, which is a powerful air pollutant. Ozone, particulates, methane, particles, nitrogen oxide, sulfur oxide, diesel exhaust, vehicle emissions, and other hazardous air pollutants. All these can lead to cancer, adverse birth outcomes, neurological problems, reproductive problems, increased hospitalizations, respiratory diseases like asthma. So next slide. We can't talk about this without talking about wildfires. In some areas of the US, wildfires are becoming more frequent and intense. And we've seen the wildfires that are burning right now in in California and a couple of surrounding states. Right now, California has 5 of its 6 largest fires on record are currently burning. And I'm going to put a blog in later into the chat so that you can, that one of my colleagues just released yesterday who lives in California. But that's a big issue. We saw, I'm looking outside because I remember a couple of weeks ago, people were reporting here in Maryland that there was a discoloration to the sky, and we're told that it was because of the wildfires as far away as California. So particulate matter is in that. And those are the things that we breathe. And I'm going to talk a little bit in a minute about why particulate matter is so important. Another reason why it's so important that became obvious this summer. And to do that, I'm going to talk about the disproportionate impacts of climate change. And we'll start working on, start that with the next slide, Sarah, thank you. So for communities, Black Americans are exposed to significantly more particulate matter, about 1.5 times more than the population as a whole. Poor people were exposed to 1.35 times more, and all non-whites were exposed to 1.28 times more. And this was from an article published in the American Journal of Public Health. Environmental justice communities constantly deal with issues that other communities never have to deal with, never encounter. This includes greater exposure to outdoor air pollution, as I said a minute ago, like those caused by methane and other greenhouse gases, from living in proximity to fossil fuel industries. And you see now, this is a picture of kids. I've actually been on this street. This is in Texas. And the street actually is a street that people live on to the right. And on the left, you see this facility. Also, EJ communities deal with issues around food insecurity, water insecurity, the lack of affordable living areas, substandard housing, very low income, which as I mentioned earlier, makes it so difficult to pay their energy bills. In the Northeast and in the Mid-Atlantic region, people of color are living with 66% more air pollution from vehicles than the white residents are. And race, not poverty, has been found to be the strongest indicator of exposure to at least PM 2.5. So quickly, let's talk about one of the respiratory diseases that you see a lot of when you're dealing with particulate matter. If we can go to the next slide. Asthma. According to the World Health Organization, more than 200 million people suffered from asthma last year. And it's a common disease among children. Black Americans are 3 times more likely to die from asthma than white Americans, and that number increases to 10 times more likely when you're talking about children. The number of adults, and this isn't based on race, the number of adults age 18 and over who currently have asthma, 19.2 million. The number of children under age 18 who currently have asthma, 5.5 million. The number of physician office visits with asthma as a primary diagnosis, 9.8 million. The number of emergency department visits with asthma as a primary diagnosis, 1.6 million. The number of deaths from asthma, 3,564. Okay, Black Americans are 5 times more likely to visit the emergency room for asthma and 3 times more likely to die. One of the reasons for this is health insurance or lack of health insurance, and people treat the emergency room as a visit to their primary care physician because that's where they have to get medical treatment. And I wanted to briefly touch on particulate matter and the relationship to COVID-19. In studies in China, in Italy, in even a Harvard study that was released this summer, all of these were released this summer, there's a suggested correlation between PM 2.5 and COVID-19 infection. And the thinking is that the COVID-19 virus hitches a ride on PM 2.5. PM 2.5 lodges in the lowest, smallest part of your lung. And we know that the main issue with COVID-19 is respiratory and lung function. And of course, the CDC is saying that, it's saying now that air pollution, that inhalation may be one of the routes of exposure. But I think from the fact that we're wearing masks and that research has shown that COVID is airborne disease, airborne infection, that people who already are at risk because they live near a facility or at risk because they live near areas that are at risk from wildfires, those people are going to be more at risk probably from COVID-19 infection because their lungs are already at risk, are already charged. So I wanted to share with you quickly that the COVID-19 mortality rate as of September, this is a report that was released by the APM Research Lab. The next report won't come out until October 15th. The mortality rate for COVID-19 for Blacks is 3.4 times as high as that compared to whites. For Latinos, it's 3.3 times as high. For Indigenous people, 3.3. For Pacific Islanders, 2.9. And for Asians, 1.3. So people of color are more at risk from infection from COVID-19. So why is all this important, right? I've told you a little bit about why you should care. So as of July, and this is very important information, this administration has rolled back or is in the in the process of rolling back at least 100 environmental laws, 100. 68 are already completed and 32 are in progress. And just so you know, some of those were rolled back during the height of the COVID, I guess I want to say struggle, because we're still in the middle of it. But when we first started panicking and trying to determine what we should do, air pollution and emissions were the specific focus of 27 of those 100 rules. 19 rules related to air pollution and emissions were rolled back, and 8 are in progress. All told, the environmental rollbacks could significantly increase greenhouse gas emissions and lead to thousands of extra deaths from poor air quality each year. And that's why this is important, and that's why one of the reasons we're here today. So in addition to all that I've told you, most of which happened in the before time, before COVID, although as I mentioned, some rollbacks happened while we were dealing with COVID. In this moment, where COVID is wiping out millions of jobs and trillions of dollars in wealth, we need environmental protections, right? We don't need them just reinstated, we need them to be improved also. Several months into the COVID-19 pandemic crisis, lower income families are still struggling to pay their energy bills. And that's a big concern during extreme events like summer heat waves, which can be deadly, especially for elderly people, young children, people of color, and the poor, and the homeless. Energy insecurity is already a widespread problem in the United States, and it disproportionately affects those at or below the poverty line. And Black and Hispanic households, families with young children, people with disabilities, and those who use electronic medical devices are at risk. So borrowing from the show, The $6 Million Man, and potentially dating myself, I want to leave you with this. We can rebuild. We have the technology and we have the capability. And with that, I'm excited to turn this over to Jeff as we think about the last question, what can we do about the issues that I've described? Thank you. Jeff?
Thank you so much, Dr. Hollis. I appreciate it, and thank you for the brilliant introduction about why all of this is so important. I'm gonna take control of the screen here now, and I'm going to walk through some details about the Energy Policy Simulator. So this is a tool that it's a free and open source software tool that climate and health advocates can use to help understand what policies will have what effects on pollution, and also other metrics like financial cost and savings and so on. So let's get started. So the goal is to help policymakers, advocates, and others understand energy and environmental policy impacts and predict them, and thereby find the best way to meet climate, financial, and other goals. All of the data is unbiased and publicly available data from government sources and peer-reviewed journals and so forth. The Energy Policy Simulator has been adapted for a number of different countries and regions. So this includes, so the list is shown on screen here. And as Sarah mentioned earlier, a number of US states are in the works as well. So there exist many different climate and energy policies out there. So the challenge policymakers and advocates face isn't really to come up with a good climate and energy policy. It's to sort through the large number of climate and energy policies that are already out there and figure it out, given limited time, limited political capital, limited money, what policies you want to prioritize to reduce pollution and including greenhouse gases. This is made more challenging by the fact that policies interact with one another. For example, if you have a policy that promotes wind power and you find it reduces pollution emissions by 1 unit, and a policy that promotes energy efficiency, reducing electricity demand, and it reduces emissions by 1 unit, and you enact them together, your total reductions will be less than 2 units because some of the electricity you save from the efficiency policy comes out of what would have been generated by wind under the wind policy. The opposite can also happen. For example, a policy that promotes electric vehicles is more effective at reducing pollutant emissions when the electric grid is more decarbonized. So a computer model can be used to predict these interactive effects of dozens or more different policies all at once on financial outcomes, pollutants, public health, and so forth. This is a very high-level overview of the components of the model, and we'll delve in a little later. But these are the 4 biggest sectors: industry and agriculture, buildings, transportation. These 3 demand electricity and tell the electricity sector how much to produce, given transmission and distribution losses of electricity. They also can demand district heat or hydrogen. And there is a carbon capture and sequestration module in the model that represents technology to capture carbon dioxide and store it underground, which industry or the power sector can use. Upstream of this is a fuels component, which sets different properties of fuels, like their price, their pollutant emissions for different pollutants per unit of fuel burned in different technologies. And that does vary depending on what is burning the fuel, because some technologies can combust fuels more completely than others. There's a full set of research and development simulation, which includes endogenous learning. So prices come down faster as new technologies are deployed more, as well as a set of control levers you can use to test scenarios with accelerated R&D advancement. We also have a full land use and forestry module in the simulator. One of the key outputs is a set of 12 pollutants. I'll be showing you the 12 pollutants later. It includes important pollutants for public health, such as PM 2.5, nitrogen oxides, sulfur oxides, and so on, as well as greenhouse gases, of course. Another important output is a set of cash flows. That's financial costs of different things and this financial savings, since many of the policies do save money, often by reducing fuel expenditures. And that money then can be put into other things that can then generate jobs in different industries. I'll show you some of these outputs very soon. I won't read through all this, but this is just to highlight the fact that the model, each sector of the model is broken down in different ways. For example, buildings are broken into building components and building types. Industry is broken out into various industries. Electricity is broken out into different types of plants that generate electricity. And transportation is broken out into different vehicle types, both for passengers or freight, and also handles different vehicle technologies, like a gasoline engine vehicle versus a battery electric vehicle. This model has been extensively peer reviewed, and there are a lot of collaborators we've had over the years. It's been developed and enhanced, including US national laboratories, universities, and especially for the various adaptations in various other countries and regions, we have various global partners. So I'm going to switch to actually showing you the tool itself now. And there'll be time for questions after, so don't worry. We're right now on the global homepage of the tool, which is available at energypolicy.solutions, as you can see in the URL bar of my web browser here. The global homepage includes this box for the energy policy simulator where you can select a region. These are those same regions I showed you in the PowerPoint slide, with more coming soon, like those US states that were mentioned. We're going to be using a pre-release version. So it's going to be releasing very soon, hopefully within a week or so. And do sign up for that email list Sarah mentioned, and you'll be notified upon the release quite soon. So I'm going to switch to this version, which is running on a pre-release server. And this is the United States Energy Policy Simulator. This is what you get when you go to the US version. It's the landing page with some intro text. Let's jump into the simulator itself, and I'll show you the basics. There's a lot more to explore. So the graph on the right is currently showing carbon dioxide equivalent, or CO2e emissions. That's a total of all greenhouse gases standardized into units of CO2. This is for the entire United States. You see the red line here is new scenario, as you can see in the key. The key at the bottom also shows business as usual. You don't see that line because it's being covered by new scenario. New scenario is the policy package we're designing, and we haven't added any policies to it yet. So it's right on top of business as usual. You also see on the graph this 2025 target that the United States agreed to in the Paris Climate Accord of 2015. On the left, you will see this is a menu where you select different policies to implement, and they're broken down by sector. So here would be the policies that affect the transportation sector, electricity, industry. Some are cross-sector. For example, you can see cross-sector policies include carbon capture and sequestration, a carbon tax, ending fossil fuel subsidies, and so on. Some of them, like carbon tax, can be further subdivided. So here we can set different carbon tax rates on different sectors, or we can exclude some sectors from the carbon tax. If we click on one, like electricity supply, we get a slider, and you can set the carbon tax rate to anything you want, from 0 to, in this case, $300 per metric ton of CO2 equivalent. If we slide the slider, for example, to 45, it'll think for a moment. It's running it on the server, and you saw it animate the transition. And now you can see the new scenario line is diverging from the BAU scenario line. Right now, it's diverging gradually. And that's because it's reaching $45 per metric ton out here in 2050. It's not $45 per metric ton tomorrow, but you can customize that. All you have to do is click on the Customize Implementation Schedule link, and it will show you how the policy is ramping in from 0% to 100% of whatever setting you chose, in this case, $45 per metric ton. But let's say we want to simulate ramping in this policy faster. We could type in a year like 2030 and an implementation percentage like 100% and add it. You can see this little preview graph shows the policy will be reaching full strength by 2030. And then if I hit OK, it'll think for a moment and apply the new policy schedule. Now you see the pink line or the orange line is diverging faster from the black line up through 2030. And then the gap between the black and the orange is relatively constant after that because the policy has stopped getting any stronger. As we add policies, they appear in this lower left box. So you can see the carbon tax is now listed there with the clock icon to show we customized its timing, its implementation schedule. It also has some settings shown here, including setting for the COVID recession. If you're wondering why the BAU case has this dip here, that's the recession caused by the current COVID crisis. So the scenario has the simulator has a couple built-in scenarios that I would like to show you. This brings up a comparisons pane. You can create and save your own scenarios to the server, and they'll appear in this list. I'm going to enable these two, which are built-in or reference scenarios. So you can see the green line exceeds the US NDC target and continues on linearly from there. The blue line is a scenario we designed that reaches net zero or even slightly negative emissions by the year 2050. Notice that the zero line here is now above the bottom, and this is negative 500 along the x-axis. So you can compare these different scenarios. I'm gonna show you some other graphs now, because we've only been looking at carbon dioxide equivalent, but there's a lot more to see. I'm gonna switch us to the BAU scenario. We can discard changes in the new scenario. We won't need it anymore. In fact, we can even remove it from the graph to make it cleaner. So we're only looking at business as usual, NDC, and net zero. So the graph navigation is done in 2 tiers. The first tier is the general type of graph. So these are all greenhouse gas graphs and CO2e. And this shows different ways you can break it out. For example, by sector, you can see here the industry sector is responsible for the greenhouse gases in the gray wedge, the electricity sector in yellow, transportation sector in red, and so on. Land use is actually negative. This is sequestration, which remains removing greenhouse gases, or CO2 in this case, from the atmosphere. We also can see all kinds of other types of things. For example, we can look at electricity generation by type, in this case, coal, natural gas non-peaker plants and peaker plants, nuclear, hydro, and so on. But let's look at different scenarios here. So we're looking at BAU. This is what happens if we don't enact any policies. But if we were to enact the NDC policy package, that's the green line I showed you earlier, you can see it animates the transition. And now you can see coal is being eliminated by about 2029 in this scenario. And you can go back and forth and you can design your own. I want to show you the public health graphs though, because this is focused on public health today. So I'm going to switch to the human health and social benefits category. And I'm going to look at avoided premature deaths for now. So you can see that we have the US NDC scenario in green, and the net zero in blue, the same 2 we were looking at before, but now we're looking at avoided deaths per year. So by 2050, this scenario is reducing deaths, and this is due to particulates, by over 26,000 US deaths per year, and this one is reducing the death rate by 45,000 per year. There are a number of other public health metrics that you can pull down and examine here. For example, we can find avoided non-fatal heart attacks, because air pollution can be a trigger for inflammation and heart attacks. You can look at avoided asthma attacks. Dr. Hollis discussed the importance of asthma. We also have some metrics like lost work days. And I'll show you this one called monetized avoided deaths and social benefits. So this takes the avoided deaths and monetizes them using the value of a statistical life, or VSL figure, that the US Environmental Protection Agency uses for its policy analysis. And it monetizes avoided greenhouse gases based on the social cost of carbon, a published figure the government uses to assess the value of those things. So you can see that the benefits here, social benefits valued in dollars, end up in the hundreds of billions per year. Now I'm going to, let's show you another graph type. I'm going to toggle to NDC scenario. I'm going to remove net zero from the graph here, and I'm going to show you a CO2e wedge diagram. So here's that green line I've been showing you for that NDC scenario, and same as before. And the black line is business as usual, but now the gap between them is colored with a bunch of different colored wedges. Each one represents a policy. For example, this one is early retirement of power plants, coal-fired power plants in particular. This one is a carbon tax in purple, or industrial energy efficiency standards in blue. So this graph can break down a policy package and show you which policies are most responsible for emissions reductions in different years. And this helps drive insights. For example, you can see that think that the power plant retirements are important, but they trail off because we run out of coal power plants and there's no more to retire. So once there are no more to retire, the early retirement policy is no longer effective. And other policies become the most important ones for decarbonization. We haven't looked at financial outputs, but that's the last thing I want to show you before we do some polling questions. So one of them I'm going to show is financial costs and savings. And I'm going to start with just looking at the total only line. So this is that same green package. And you can see that positive numbers here mean increased in costs, meaning spending. Negative numbers mean a decrease in cost or spending. And this is on capital and operational expenditures. So that's equipment like power plants and cars. And operational expenditures are mostly going to be fuel, though labor costs are in there too. But they're the way that the policies mostly influence fuel costs. And this is a pretty typical pattern where you'll see the costs increase in early years because you're investing in new, more efficient equipment. You're building, clean energy power plants. You're buying more efficient vehicles. You're upgrading industrial assembly line equipment. And that creates fuel savings. And the fuel savings accumulate because the equipment you installed in this year and this year and this year and this year all continue to exist in subsequent years, and it continues to drive fuel savings. So the fuel savings are enough to outweigh the added equipment cost, and they start bringing costs down until you achieve net savings. And then as you continue to deploy more efficient equipment and clean energy, the savings grow from there. You can also look at some macroeconomic indicators like the impacts on jobs and GDP. So this is the last graph I'll show you right now. The black line is the total change in jobs or employment as a result of the policy package, and it's broken down so you can see other jobs, manufacturing and construction jobs, and fossil fuel jobs. These are mostly fossil fuel, not too many electricity sector jobs. So you can see that the policy package is slightly reducing fossil fuel jobs, but it greatly increases the number of jobs in manufacturing and construction and other jobs. So when this is driven by financial savings, when people save money, they spend it on other things like services, so that generates jobs in the service industries and so on, and those are part of the yellow line. There's a lot to explore here, more than I can show you in this overview. Before we turn to open-ended questions, I'm gonna give a couple polling questions, and Sarah will help with the polls. So I'm gonna toggle to the new scenario. I'm gonna remove NDC. Well, here, let's go to avoided. So we're going back to public health for our questions. So we're going to avoided premature deaths, and we'll remove the NDC from there. So your first question is about avoided premature deaths. So let's say we were to implement a carbon capture and sequestration policy. That's a technology that removes carbon dioxide from exhaust. So would that policy increase or reduce the premature deaths due to particulates? You should see a poll box pop up, and you'll have about 30 seconds to choose whether you think carbon capture and sequestration would increase or reduce premature deaths due to particulates. Remember, this is a graph of avoided premature deaths. It's showing 0 right now because we don't have any policies turned on right now. We're in a blank new scenario. We're going to turn on the carbon capture policy in a minute to show what happens. Positive numbers here are okay. We have the results. 17% think that carbon capture will increase premature deaths. 83% think that it will decrease premature deaths. So let's put on a carbon tax. Now remember, positive numbers here are avoided deaths, so negative numbers are increased deaths. Let's say the industry sector, not carbon tax, carbon capture. let's say the industry sector captures 30% or 35% of its CO2. You see negative numbers. That means increase in deaths. So the people who said increased deaths are correct, negative avoided or increase. Why is that? It's because carbon capture technology only captures CO2. It captures carbon. It doesn't capture particulates or nitrogen oxides or sulfur oxides. And carbon capture is energy intensive. You need to burn more fuel in order to power the carbon capture equipment. So you're burning more fuel, you're capturing the CO2, but you're releasing the particulates and the precursors to particulates like nitrogen oxides and sulfur oxides. So while carbon capture is effective at reducing CO2, it increases deaths because it increases particulates and their precursors. So now I'm going to ask another polling question, and then we'll open it up to broader questions. I'm going to revert this to blank scenario, and we're going to ask, so in a set of policies that reduces net greenhouse gas emissions to 0 by 2050, that's the net zero scenario you saw, it's an aggressive set. Which policy is responsible for saving the most lives? And this is from, again, particulate emissions. So your options are an electric vehicle sales mandate, a carbon-free electricity standard, and industrial electrification and hydrogen use. All three are going to 100% by 2050. So by 2050, we'll have 100% electric vehicles for the vehicle type, for passenger cars and so on. A carbon-free electricity standard, 100%, or 100% industrial electrification and hydrogen use. So you'll have about 30 seconds to decide which of these seems like it will save the most lives. Okay, we have our answers in. The carbon-free electricity standard is the most popular answer with 55%, electric vehicle sales mandate at 29%, and industrial electrification and hydrogen use at 16%. So let's take a look. So we're gonna look at the net zero scenario, and we're gonna switch to the wedge diagram. So this is similar to the other one we saw with, but now the wedges are showing avoided premature mortality. So you can see that in the wedge here, in the largest wedge in 2050 and in most years is the carbon-free electricity standard. So that is the policy that saves the most lives among the three. This one here is industrial electrification and hydrogen, and it becomes the most important by 2050, though it's less important earlier where industrial energy efficiency standards are here. So this is reducing consumption of fossil fuels by industry, but slowly it gets squeezed out because industry converts over to electricity and hydrogen, at which point how efficient it is matters less because electricity and hydrogen aren't emitting pollutants. The EV sales mandate is here, and it's responsible for saving 3,600 or so lives per year, which is a great policy, but it is not as strong as these others. And in part, that's because the transition to EVs is already partially going to happen due to economics in the BAU case. So electric vehicles are coming down in cost rapidly, and they're going to become cheaper on a lifetime basis over the life of the vehicle than gasoline cars pretty soon. And that's going to drive some shift to EVs, and a sales mandate becomes less important to drive further adoption once the economics are able to drive a lot of adoption on their own. But also it's because coal is a big particulate emitter, and the power sector and the industry sector are the coal users, and the petroleum burned in the transportation sector, while still dirty and still producing particulates, doesn't produce as many particulates as coal does. So that covers it for the polling questions, to give you an example of how the simulator can help answer interesting questions. I'm going to just put back on this graph, enable some scenarios, and I think we'll turn it over to questions now. Sarah, will you help with that?
Absolutely. Thank you, Jeff. So one question that has come up from a couple of people is about the modeling assumptions behind the public health impacts, where that data comes from, and if we can share that.
Yes, so I can share that. In fact, I can share all data in the EPS because it's free and open source, and all data is are public. First, I'll show you where to get the data so that you can answer this question for yourself about any given data. You hit the link there. This button here will go to the online guide, the documentation, and you hit download model. So if you download the energy policy simulator here, and there are instructions for how to use it, but if all you care about is looking at the data, you don't actually have to be able to run it. Every piece of data is carefully cited in the model package when you download it. The data about public health impacts are from the US EPA. They have run a gridded air quality simulation and public health impacts equations. They have a tool called BenMap, and they have published multipliers called reduced form tools that are used to convert emissions into public health outcomes. So they publish these tools exactly for the type of use case we have here, for folks who need a fast running tool, like a model that runs quickly, so we can't run a gridded air quality model every time anyone moves a slider. So we're using their reduced form tool set to convert emissions changes into all of the different public health impacts. Great question. I think that covers it.
That's great, Jeff. Thanks. Another question is, does this model have the potential to be used to project large-scale proposals, the impact of large-scale proposals like the Green New Deal?
Yes. In fact, each of these lines, the green line and the blue line, is itself a very large-scale proposal. Like if you look at either one of them, we're set to net zero right now as the active scenario. The policy settings list in the lower left shows all the things it contains. It contains aggressive electric vehicle sales mandates, hydrogen vehicles for trucks and ships, building component electrification, that is, no new natural gas in new buildings and stuff, building efficiency standards, industrial policies, and so on and on and on. So we have many different types of policies in this tool. So what you do, and it's quite common that a use case would be you take a policy proposal, a Green New Deal, or whatever in a different country, whatever their policymakers are proposing, and you just go through and you enable all the policies that correspond to the proposal, and it will tell you how it will come out. One trick is that some proposals are not very specific. So this is going to ask, if you're doing a carbon tax on the industry sector, as we are here, how many dollars per ton is it? And sometimes a policymaker will propose something and they just say, let's levy a carbon tax, and they don't say what the dollar value is. So if you're trying to model a policy package like that, you may need more details, or you may need to choose what the value is because the policymaker never said. So the main tricky part about evaluating policy packages is when the policymaker themselves propose something without specifying the numbers behind what they're actually proposing. But assuming you know what the package is, yes, you can use this tool to model it, absolutely.
Thank you, Jeff. Here's another great question. Does the model include the money saved by reducing the health impacts, the morbidity, so for instance, the healthcare costs that are associated with the morbidity impacts?
Great question. Unfortunately, it does not include the money savings on reduced healthcare costs right now. It includes other types of money savings, as I showed you in that cost savings graph, savings on things like or costs on things like capital equipment, fuels, labor, and operations and maintenance. And it measures those public health impacts in terms of avoided hospitalizations or lost workdays, but we have not currently put in anything that converts the lost workdays or the avoided asthma attacks into dollars.
That's great. Thanks for sharing that, Jeff. I think that's important, that the health benefits of climate policy is going to far exceed the benefits of reducing air pollution, as Dr. Hollis pointed out earlier. Here's another really important question to ask, I think. What guidance exists to help users make rational scenario choices? And what guidance exists to help users make scenario choices that will achieve certain benefits?
That's a great question too. So there are a few resources you can use. So if you're starting with a new scenario, blank, and you're interested in a policy, all the policies have some guidance text in them. So for example, let's pick a new policy because we've been using carbon tax a lot. Let's look at a fee bait. That's an unusual policy. Many people aren't familiar with it, which is why I'm using it as an example. So there's a description. It says what a fee bait is. It's a fee on the sales of inefficient light-duty vehicles that is rebated to buyers of efficient ones, and it explains. And then it provides guidance for setting the rate. So, and it's a percent of the global best practice rate. So this text will help. Then, if you want even more, the policies have a link. It says how to design this policy well. If you click on that, every policy in the model has at least a short blurb explaining a bit more about it. Some are longer than others. For example, if we go to the carbon tax one, I think we have a bit of a longer description here. And we even have an applicable chapter in a book, Designing Climate Solutions, which is available free online, by the way, completely free, that explains in great detail about all these different policies. So you can click through to get to these book chapters and read this entire book. It's also available to buy in paperback, but you don't have to buy it because it's all free online. So the resources go pretty deep. It starts with short blurbs and then goes on to web longer blurbs and even on to an entire book. So we have a lot of resources for you, depending on how much time you want to spend. The last thing I'll mention is that you can examine the included reference scenarios. So we tried to make, given their goals, we tried to make them as reasonable as possible. So net zero is hard, and that's going to mean there's some pretty strong policies in here. NDC is a little easier, and so we have some policies that are a little less strong and a little easier to enact. So you can see our examples is another way. So and also there's the manual. So there's also the documentation. Though this is mostly about how to use the simulator and a little bit less about how to pick smart policies. So I would say all of those resources are available to you, and they're all for free.
Thank you so much, Jeff. And as a reminder to folks, please sign up for our newsletter so that you get access to the new model when it's released. And I want to now pass it over to a physician activist, a climate advocate who is going to share a few closing insights about how this tool can be powerful for advocacy.
Thank you, Sarah, and thank you so much, Jeff, and the entire Energy Innovation team. This is such an incredible tool. And I want to build upon something that Dr. Hollis said, which is, what can we do about these issues? And what we can do is we can use tools like this to become better advocates, to spread the knowledge and spread the awareness of things why climate change is such a health issue and why we need tools like this to make our case. So, if you think about it, our health is affected by so many different things: temperature, outdoor air quality, extreme events. Dr. Hollis talked about wildfires. I'm just going to focus for a minute on poor air quality. Next slide. So the health benefits of cleaner air. So we're at the 50-year anniversary of the Clean Air Act, implemented in 1970. We know because of the Clean Air Act and its subsequent amendments, emissions of major pollutants were reduced by 73% between 1990 and 2015. 230,000 deaths were avoided per year due to lower concentrations of outdoor particulate matter, and the economic benefits valued at $2 trillion in 2020. Next slide. So we can use a tool like this and really break it down to something like transportation-related air pollution. And so one of the things that Dr. Hollis had mentioned was PM 2.5. So what I can do as a physician is I can go into this tool and I can look at the conventional pollutant standards of light-duty vehicles and how much PM 2.5 they emit. And I can look at, is there a percent reduction in emissions from 10% versus 50%, and see the direct human health and social benefits, such as avoided respiratory symptoms or bronchitis. And we use this information, we can use it in opinion pieces, so creating a narrative of a future that could be. In 2050, with a 35% reduction in PM 2.5 due to policies directed at light-duty vehicles, X number of lives were saved. We can also use this information with policymakers. X number of your constituent lives were saved. X number of people didn't have to go to the emergency department because of the policies that you created to address PM 2.5 and light-duty vehicles. We can also use this information in presentations with managers, with colleagues. You can look at avoided work days, reduced number of hospital admissions, a lot of great data to kind of make your specific point, especially as we become advocates and really talking about the direct health impacts. And with Thanksgiving a couple of weeks away, but sort of around the corner, really you can use a tool like this in conversations with family and friends. So let's say you're trying to convince your dad to buy a more environmentally friendly vehicle. You can potentially show him the number of avoided premature deaths with using a more eco-friendly vehicle that releases less PM 2.5. So next slide. So that's really it. I mean, I'm really grateful that Energy Innovation has a tool like this, and I think we'll all benefit from being better advocates because of the information this tool provides.
Thank you so much, Dr. Tummala. We really appreciate you joining us, and Dr. Hollis for joining us. I know we didn't get to answer everybody's questions, but if you do want to use the model, Energy Innovation is here to support you. Please feel free to email us. You can email me directly at sarah@energyinnovation.org. I also wanted to quickly share a couple of announcements from our partners about some other great events that are coming up. APHA has a really excellent racial equity series that I wanted to make sure you knew about, and one will be specifically focused on environmental justice in November, so don't miss signing up for that. The Medical Society Consortium, who also partnered with us on this webinar, also has launched a new campaign to share your story about why, as a health professional, climate action is so important to you, and you can share your video online. And that would be a great place to incorporate some of the numbers and the figures that you gather from the EPS. So thank you again, everyone. And we look forward to being in touch with you. Thank you.